One is open vascular surgery, and the second is minimally invasive endovascular surgery.
Okay.
And you can argue as to what's better, but it's really a complex situation to discuss. We'll see if Mina wants to touch up on that.
Well, the way I phrase it is it's very patient specific, and so it depends on several factors. It depends on how sick the patient is, if the patient can tolerate one or the other, the anatomy of their occlusive disease, right? They can have a single level occlusion, right, which is just an occlusive artery in one location, such as the superficial femoral artery in the thigh. They could have multi-level disease. Oftentimes we get smokers and diabetics with end-stage renal disease on dialysis. So they have aortoiliac occlusive disease, fempop disease, and tibial disease, right? So there are so many things that play a role. How does the wound look if they have a wound? Do they have rest pain? It really is a second podcast, but what I can boil it down to is it really depends on the patient. Can they tolerate an operation? Can they tolerate a bypass? Do they have a good vein conduit or some kind of conduit available for the particular bypass? What's the target of the bypass? Are we going to a big artery or a small artery near the ankle or the foot? Right? All those things play a role in the amount of success that we're going to have with a treatment plan. So we have to come up with that, and it takes sometimes weeks to months to come up with that.
Gotcha.
Hence the importance of knowing this and referring the patient earlier on.
There's no like plasty type of procedure for this. It's going to be a bypass.